It's time now for the Business of Health, brought to you by Hendricks Regional Health. Where you live shouldn't determine how long you live. That's the message from Eli Lilly and Co, which is launching a pilot program aimed at addressing the high incidence of diabetes in select neighborhoods. The 5-year, $7 million program will focus on 3 Indianapolis neighborhoods that Lilly says have significant health disparities and high rates of diabetes. I sat down with CEO David Ricks to talk about the model, its impact, and the state of the company.
Well, we've been active in diabetes and trying to improve the lives of patients with diabetes for a long time, and we've done a number of global health initiatives outside the U.S. But the Fairbanks study, which really demonstrated the disparity in life expectancy and in diabetes status by zip code, caught our eye. So they showed this analogy with the Monon Trail, that at the top of the Monon Trail, you live life expectancy and quality of life similar to Switzerland and Japan. At the bottom of the Monon Trail, it's like Bangladesh. And of course, Lilly's at the bottom of the trail too. So this really motivated us to work with Eskenazi to put a program like this together.
And this is a neighborhood model, if you will, that typically you have implemented in other places outside of the U.S., in Mexico and India and South Africa and other places.
Correct, yeah. The goal of these global health programs is to find practices and how to organize health care in underserved areas so that patients can get better care, prevent disease if we can, but if not preventable, treat it in a much better way. This is what we're replicating now for the first time in the U.S., this kind of global health program in an underserved neighborhood, and we've picked 3 neighborhoods in downtown Indianapolis.
Talk about basically how the model works, or how this program will work.
Right, well, we're giving a grant to the Fairbanks group here at IIPY. They're coordinating what is a series of pilots and projects to try different things to improve the health status, specifically the diabetes health status of people who live in these neighborhoods. So it's not going to be just one thing. It's going to be many things, whether it be exercise programs, access to healthy food. These are known contributors to diabetes, or access to health care itself, and that's where Eskenazi can play a big role.
And again, the impact of this initiative, $7 million over 5 years, can be felt throughout the Eskenazi system, but far more broadly than that, perhaps throughout the country.
That's right. Along with our partners, our shared goal is to figure out what can work in this kind of environment, in an urban neighborhood, ethnically diverse, with lower socioeconomic status. If we can find a few common threads that could be spread, we'll publish those, and along with Eskenazi and the IPY team, IU Med School, will publish that and really try to propagate those practices as best practices so other people can benefit.
You look at the impact, the devastating impact really of diabetes on families, the human toll, but that also translates into a business toll. Businesses are paying the freight too in places like Indiana where it's such an issue.
Exactly, Gary. You know, as highlighted earlier this week in my speech, the really for Indiana, my view, our view at Lilly is healthcare is sort of our kryptonite. It's the piece of our business environment that's not working. Healthcare costs in Indiana are much higher than they should be, and it's a cost that businesses are bearing. So diabetes is one of the key diseases we need to get after to change that. It's a chronic disease. It's very expensive, more than double the cost per active employee who has diabetes, and it's affectable. It's a lifestyle and diet and exercise set of drivers. We can change those things and reduce the cost of doing business in Indiana. That's good for the economy, and of course, it's good for the people who might be at risk for diabetes.
We're into the second quarter of the year. As you look at the state of Eli Lilly and Company, certainly an iconic company for our state. Give us your take on the state of the company.
State of the company's good. We just announced our first quarter earnings, grew 9% on the top line, mid-30s on the bottom line. That's a strong financial performance. That is impressive, but what's really impressive to me is the quality of that. We're really driving that off a new set of products. 9 products we've launched since the end of 14. We hope to launch even 6 more in the next 18 months. That's the kind of research and development productivity we haven't seen in our history, and it'd be unprecedented for a company our size. That's driving growth. Those products will last a long time. I think we've got a bright period ahead.
What's key in your view to continued growth, continued success as you look through 2018, but obviously more long-term into the future?
Well, of course, driving those new brands is key for our business. Investing in research, and that's always changing, and it's a challenging area. Its success rates are low, as you know, but we have to keep at that. Human disease knows no boundaries. There's always another problem to solve, and I think the science has really developed in a positive way. We need to recruit and attract great people. We need to invest and put a lot of money at risk to find the next medicine for a serious condition like diabetes. We're committed to that. We're spending a lot of money, $5 billion a year, on research. We have to continue to do that and do it better and better. Increasingly, we're partnering with other entities, medical schools, but also biotech companies to bring forth those new medicines. That's a new capability for us.
Lilly CEO Dave Ricks, who estimates that some 10,000 residents suffer from diabetes in the 3 targeted neighborhoods in this particular initiative. And we'll be following the program as it develops and certainly have more reports going forward.